Okay, so with Chelsea here, she's been having jaw pain, temporomandibular joint pain, and she's having problems with opening her mouth. So this purpose of this video is to show you the basics of what I do to treat TMJ problems by targeting the masseter muscle and the medial pterygoid muscle, which are both innervated by the mandibular nerve of the trigeminal nerve, the mandibular branch of the trigeminal nerve. So Chelsea, open your mouth for me. Good. And close. And open. And see a little bit of trembling and a little bit, you don't see it now, but a little bit of shifting down to the left. Okay. So when I see this, rather than working on the joint itself or doing massage, I go intraorally. Our scope of practice allows that. And so what I use is a vinyl glove. And open your mouth for me. And so what I do is I go along the top of the ridge of the molars and open for me a little bit. Okay. And I go right in that area. That's good right there. Okay. And I go right up into the corner of it. So if you relax your mouth for me, as the patient relaxes, you'll feel the medial pterygoid push into my finger. And from there, what I do is I just gently massage that muscle. And it's very, very sore for the patient. And in fact, I teach them to do it themselves as well. And I'll do this when I do it. You don't have to do it for very long, for about 30 seconds. Just open your mouth a bit. Good. As they open, as you do it, it starts to release. And let it relax now. Close your mouth, let it relax, and you'll feel it again. So I get right in there. Okay, I'm going to come around here. I'm changing my glove because I'm going to the left side. And this is really in real time. Open for me. Along the ridge there, and just let it relax. And close for me. So here, the mouth is, you can see the mouth is, show your teeth there. Totally closed, and here, there's not a lot of resistance on my finger. But on the left side, the medial pterygoid was pressing up against my finger, and her mouth wasn't even that closed at all. So here, I'm actually going to go back to the other side and work back. Open for me. And let it relax. So here, so this needs to be released. So this in itself, if the patient doesn't like acupuncture, I would just do this and adjust their mid-thoracic spine, their cervical spine if it's needed. Okay. So now, Chelsea, if you just open and close for me. And again, so considerable improvement, you can tell. Right? So what I'm going to do here is I'm going to needle the masseter motor point, which is 2 inches distal from the condyle of the mandible. Just going to stimulate this. Just turn your head, that's perfect. See that on camera? Yeah, that just stimulates it. Good. And I'll couple that with putting one right inside the temporal mandibular joint to anchor it. And then I'll get the extend unit. And I'll get it going. You'll start to feel a pulse. Great. And
Yep.
That's how you treat TMJ disorder in under 5 minutes.